I would like to welcome you all to this occasion, which as we as pharmaceutical sector consider very important as far as public health is concerned. Today marks a milestone in policy formulation in the health sector, with the launch of 3 guidelines, namely guidelines on good distribution practices, guidelines on disposal of pharmaceutical waste, and guidelines on transportation of pharmaceuticals. It's very interesting that just before I left my office, I was sitting with some development partners, and the topic of discussion was the supply chain system in Kenya and how to strengthen and make it more effective and efficient. And the fact that we are now launching these documents, key documents, which are all elements that strengthen the supply chain system, I think is very remarkable. The gist of my conversation was trying to get support from development partners so that we can be able to strengthen the supply chain system, and in particular, strengthen the drug management cycle, how we are able to maintain adequate records, how we are able to use these records to be able to forecast the quantities of products that we need, how we are able to store these commodities, and how we appropriately use these commodities. So I think that this is really a very apt time to be able to launch these documents. CEO, I expect that we have the other stakeholders who may have participated in this process, and I would imagine that KEMSA would be a big stakeholder in this, and so would be the Ministry of Health's Division of Health Products and Technologies. But I commend you for having developed these documents, because they come at a time when we are focusing, as I said, on the supply chain system. We are preparing it to be able to handle the demand that will be created once we move on to the national scale-up of the UHC program. As we celebrate this great milestone and celebrate the World Pharmacist Day under the theme Safe and Effective Medicines for All, let us remember that good distribution practices are among the wide range of requirements placed on pharmaceuticals. As a sector, we have made tremendous gains since the passage of Constitution of Kenya 2010 and the Sustainable Development Goals. The proclamation towards universal health coverage demonstrates the government's commitment to the rights enshrined in Article 43 of the Constitution, the right to the enjoyment of highest attainable standard of health. While the political willingness to provide universal health coverage is a step into the right direction, its benefit depends on the quality of healthcare services provided. And the quality of commodities is an important part of that. I am glad to note that the Pharmacy and Poisons Board has actively participated in the implementation of the wider Government of Kenya development policies that embrace the implementation of universal health coverage and Vision 2030 strategy. In this regard, the board has set up systems to manage the initiatives necessary to enhance efficiency and effectiveness in control and management of medical products and health technologies in the country. Key focus of the information systems implemented at Pharmacy and Poisons Board is to ensure quality and safety of medicines. This has led to the introduction of systems like the short code SMS services for health safety code, regulatory human resource information system, and the online submission system used to manage registration of therapeutic products, including medical devices, herbal medicines, foods, and cosmetics. Currently, I am aware that PPB is developing and testing a system to verify medical products and health technologies, hence facilitate the post-market surveillance and pharmacovigilance activities that they undertake. I am also aware of the medicines track and trace system that PPB is working on in partnership with the University of Nairobi and other industry players. Once this is done, medical products and health technologies in the market will have a tracing number, and for ease of identification of the country of origin and traceability of the batches to the specific manufacturer. I congratulate the board for developing these guidelines, and while noting that the task ahead is enormous, I direct as follows: that the PPP should concentrate on developing consensus and understanding regarding the challenges we all face in stopping the circulation of substandard and falsified medicines in our continent, because we cannot do it alone. PPB to come up with a national approach to tackle this issue, since the problem of substandard and falsified medical products is a global problem. And PPB to develop a platform for exchange and use of information, since efficient and effective communication across stakeholders is a necessity and indispensable.
Guest of honor, Dr. Rashid Aman has other engagements. So we'll start with fellow staff, colleagues at the Farmers and Poisons Board. Welcome to the world.
Niko kwa shoti yako? Eh? Niko kwa shoti yako?
Down. And we had to understand that our guest of honor was going